Today, the Wisconsin Department of Health Services, along with the Office of Children's Mental Health, spoke out on the youth mental health crisis and how it impacts college students.
Comes after experts say in the past decade, the general state of mental health in Wisconsin is getting worse, including youth mental health. Samantha Kamali listened to today's news conference and shares what experts and students recommend college students should do right now.
Bill and Cami Director Linda Hall from the Wisconsin Office of Children's Mental Health says they focus on the mental health of children between the ages of newborn to 26. She says in a recent study done on the mental health of college students, they looked at one main reason behind stress was academic demands, but also other reasons behind stress were world issues such as climate change, gun violence, and political divisiveness. Experts and students say data shows it's all about student engagement and building relationships and connections. Some students right now are socially anxious and shy and not sure how to start creating relationships with their peers.
Get students talking, get students meeting each other, meeting people in their field, getting things to get excited about or involved in. Just get students together and interacting.
I say quality over quantity for sure. How well are these people supporting you? You can have 10, 20 people that you're connected with, but if there's no substance within that connection, then it's meaningless.
These college students say to have a weekly planner and start to prioritize tasks that you have so you know how to stay on task. Cami, Bill?